If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411, you're in a good place, and it's time for our COVID-19 update from our Rockingham County Interim Public Health Director, Susan Young. Thank you again, Susan, for being here today. Yesterday, we heard from Governor Cooper, and he presented some new options for our public schools. Give us some feedback.
Well, Mabel, I know the new option is for October 5th to move into option A, which is the K through 5th grade returning to school like 5 days a week on their routine schedules. And I do support the governor's recommendations for parents to have that option to send their kids back to school. There's been a lot of research done about that age group of children, and they are at lower risk. And they do need that in-person learning, especially for the younger children, kindergarten, first, second grade. So I do believe that that is a good option that will be open for some parents and some children to do that. And I did go to the school board meeting this past Monday night, and I just want to give them a shout out and kudos. They have worked very hard to provide a safe environment. They have the PPE, they have the protocols in place, they have screening protocols, they have information that you can get off of the website that will tell you each and everything you need to know about your child returning to school. The Strong Schools NC Public Health Toolkit is available for anybody to read, and it will give you the broad basis of the plans that they have put into place, and it was exceptional, the work that went into the safety and support of the school system trying to get the kids back to school safely. I know that some kids will start back on option B starting Monday, where they'll go 2 days a week. So that will be interesting to see for a couple of weeks how that goes. The school district will have to vote on whether to do the option A starting October 5th. So that will be an all-inclusive decision of the school board, teachers, principals. I'm sure a lot of people will be queried about that decision.
Yeah, the toolkit that you just mentioned, the Strong Schools NC Public Health Toolkit, we have that on our website on the front page at myrockinghamcountync.com. myrockinghamcountync.com. Just scroll down and you'll see the information about the new choices that are available, and you can click the little link that goes to the toolkit. What suggestions do you, as a nurse and as a health professional, tell us, what would you like for our parents and guardians to know as they prepare for October 5th?
Mabel, there is a risk, as always risk, if you do put more people together. They won't be able to social distance quite as well, and the buses will probably not be as socially distanced as they are going to be during the option B. So there is risk, but things are being put in place to mitigate those risks. Mm-hmm. But I would say if your child has an underlying illness or a congenital problem or just something you want to discuss, call your primary care provider. Call your physician and just have a discussion with him and get their thoughts on if your child, it is a good option for them to return to in-person learning. That's always a valuable insight to, understand if your child does have some problems or underlying issues, to get that expert advice. But everything has been done that can be done to reduce that risk and to mitigate those risks for the kids returning to school. Like I said, they have excellent plans and excellent things in place.
Okay. Can you give us an update on the indicators here in Rockingham County in regards to testing, hospitalizations, recoveries, locations? I get a lot of questions about where is it? Where is it? Deaths. Give us some indication of how it's looking.
Well, currently, as you talk about the metrics for the state, I will kind of talk about our metrics for Rockingham County. Our percent positive is currently at 6.8, which that is a little bit higher than we would like for it to be, but it has come down. Around the 13th, it was actually up to 10%. So it has actually come down since then, and Our deaths have increased due to our long-term care facility outbreaks, and that is very sad. We do have currently 22 deaths here within the county as this has began for our death toll, and that saddens each and every one of us to have that occurring. But we do have some positive metrics. We only had less than 20% of our cases this week, starting from Monday to today, that were long-term care facility patients. So less than 20% is looking better. So we are looking better at some of our metrics. As far as testing is still going on here at the health department. You do need to call in and make an appointment to be tested here. Annie Penn is still doing testing. They did move the site to their short stay facility, which is in a different location at Annie Penn, and now you do have to have an appointment for that. There is some information on their website that they have distributed about that. And our western part of the county is without testing currently. The James Austin Castle Family Medical Site has temporarily suspended their testing, but they are looking at other options that we can use to open that testing back up on the western side of the county. Eden Drug is still doing some testing. That is a call, and they will come out to the car. They've kind of revamped how they're doing their testing. So if you do need a test in Eden, you can call there, and you can always call your primary care provider. And the sites are also listed on the website for the state. If you go on the DHHS website, those facilities are listed.
Locations, because
Yes.
I get calls about locations of where are most of the people who have tested positive? Where do they live? And I think you keep telling us every time we do an interview that it's across the whole county, right?
It is still across the whole county. There are no quote-unquote really hot spots going on right now. Of course, we are working on some GIS mapping to have some informatics to show that a little bit better, and Felissa Farrell, our Health and Human Services Director, has been working on that, and we hope to have that information to share soon. But of course, when you have the long-term care facilities that are having outbreaks, that is going to be quote-unquote a hot spot for those two addresses of the facilities, of course. But otherwise, it is spread all across the county. There is community spread from one end of Rockingham County to the other.
Okay, thank you very much. What about Labor Day weekend?
We thankfully did not see a spike, kind of like we did around the 4th of July.
That's good news.
That is good news. We have not
Thank
really
God.
had any sustained clusters from any events from Labor Day weekend or any social events from there. So we were very pleased that we did not see that.
Good, good. What about college students who may be coming back home?
We have actually only seen a couple of college students positive, and we're getting ready to add some information into our informatics too that kind of puts that as a category of schools, colleges, universities, so we can stratify some of that data out so we can report it out to the community also.
And last but not least, what do you want us to do?
This is the one thing that everyone can do to protect each other, your loved ones, your family, yourself, is to wear a mask. Wear it when you're out in public or in an enclosed space, or if someone in your household has tested positive and you're trying to stay away from that person, if you are around that person, that mask wearing still is very important in that situation also. Social distance, stay that social distance as far as you can from that person in public, and just treat everyone like they're infectious, because you don't know. There are still asymptomatic people out there that are showing no symptoms, but they are carriers of the virus. So just be sure, and also wash your hands, use your hand sanitizer. The 3 things that we have said are still the 3 golden rules: wear your mask, social distance, wash your hands, and use your hand sanitizer.
She keeps telling us the same thing. The masks are very important. Wear your mask. Do it for the loved ones in your life. Rockingham County 411, you're in a good place.